You're listening to an African Elements top news story for March 28, 2025. Please visit our website at africanelements.org for more daily news. Trump cuts HIV research funding. Impact on CDC, NIH, HIV prevention programs. Face drastic funding reductions by Darius Spearman. The fight against HIV is facing a serious storm. Massive funding cuts are hitting key federal agencies, threatening years of hard-won progress. The National Institutes of Health, NIH, a powerhouse for medical discovery, saw dozens of HIV-related research grants suddenly terminated under the Trump administration. These weren't minor projects. They included critical studies and clinical trials aimed at understanding and stopping the virus. Specifically, an adolescent medicine trials network program was halted. This network focused on adolescents and young adults, a group sadly accounting for 19% of new HIV infections each year. Losing these studies is a massive blow. This includes vital research like $18 million per year dedicated to youth-focused prevention efforts. Furthermore, cancer studies specifically targeting LGBTQ communities, who often face unique health challenges, were also slashed. To understand the impact, we need to know what the NIH does. It's the federal government's main agency for biomedical research, working to uncover knowledge that improves health. Within NIH, the National Institute on Minority Health and Health Disparities, NIMHD, leads the charge in coordinating research across 27 institutes to tackle health inequities. These cuts, consequently, undermine efforts to address the very disparities that leave communities like ours more vulnerable. It's not just the NIH feeling the heat. The Centers for Disease Control and Prevention, CDC, our nation's frontline defense against public health threats, is also under fire. The CDC's Division of HIV Prevention faces staggering proposed cuts, potentially $1.3 billion, or even complete elimination. Imagine losing the entire division dedicated to stopping HIV transmission. There are plans to possibly transfer its responsibilities to another agency, the Health Resources and Services Administration, HRSA. HRSA primarily manages treatment programs like the Ryan White HIV/AIDS program. This potential shift is deeply worrying. Advocates fear that moving prevention out of the CDC, an agency built for public health surveillance and intervention, could lead to prevention strategies being deprioritized. Specifically, this includes access to crucial tools like PrEP, pre-exposure prophylaxis, a medication highly effective at preventing HIV infection. Focusing mainly on treatment without robust prevention leaves a dangerous gap. Therefore, stopping new infections becomes much harder if the primary prevention agency is dismantled or its focus diluted. These proposed cuts aren't just numbers on a spreadsheet, they represent a real danger of rolling back progress. We've seen firsthand what dedicated funding can do. Since 2010, increased investment in the CDC's HIV prevention work correlated with a nearly 20% drop in new HIV infections nationwide. This success was particularly notable among young people aged 13 to 24. That's a significant achievement showing that focused prevention efforts work when properly supported. However, the fight is far from over. In 2022 alone, there were still 31,800 new HIV cases reported in the U.S. Each case represents a life impacted, a family affected, and a community needing support. Slashing the budgets for the very programs that helped reduce infections threatens to undo this hard-earned progress. Consequently, experts warn that reducing prevention funding now could lead to a tragic rise in infections, deaths, and higher healthcare costs down the road. These funding cuts don't affect everyone equally. They hit hardest in communities already facing significant barriers, specifically marginalized groups including people of color and LGBTQ individuals. The termination of NIH grants included studies directly focused on these populations, such as research on LGBT cancer, youth suicide, and bone health. Losing this research means losing knowledge vital to addressing specific health needs within these communities. The impact is felt regionally, too. For instance, Arkansas lost a staggering $158 million in grants supporting crucial areas like immunization programs and efforts to reduce health disparities. Meanwhile, prestigious institutions saw research grants for infectious and chronic diseases terminated. These cuts reflect a broader pattern impacting health equity. Health disparities affecting African American communities often stem from systemic issues like limited access to quality health care, socioeconomic barriers, and ongoing discrimination. Undermining research and prevention funding, therefore, only deepens these existing inequities. Beyond the immediate health risks, these funding cuts carry severe economic consequences. Health advocates rightly warn that slashing prevention funds now will inevitably lead to higher long-term costs for HIV treatment. It's a simple equation. Fewer resources for prevention mean more new infections over time. Each new HIV case carries a lifetime cost of care that far exceeds the investment needed for prevention. Shifting the focus from prevention to treatment creates a dangerous gap in early intervention and stopping transmission before it happens. The ripple effects extend to the pharmaceutical industry as well. Companies which develop life-saving HIV treatments and prevention methods could face significant challenges. Reduced funding often leads to less community engagement, fewer testing initiatives, and decreased awareness campaigns. Consequently, this slowdown could hinder the adoption of emerging HIV treatments. Undermining the infrastructure that supports testing and prevention ultimately harms public health and slows down the deployment of medical innovation. Copyright African Elements.